Hi everyone, Alex here, Team Alex. Welcome to today's session. Today we're going to talk about marketing. We're going to start to build a marketing funnel. And this is a really important conversation to have, and it's a really important thing to do in your business. And one of the things that I came across the other day was by a guy that I've listened to for a while, and his name is Joe Polish. And it's worth looking Joe Polish up because he's a pretty big time marketing type guy, and he gives a really interesting definition of sales. I've actually posted a video of his on the Health Leaders Academy Facebook page. It's worth having a look at because it talks about what selling is, what making a sales is, and I think the video is called, is selling evil or something like that. And it was appropriate because we've had a conversation with a number of clients over the last few weeks and months about this idea of sales and marketing. And in lots of ways, there are two parts to our practice. We have and they're very distinct parts. We have the clinical component, and then we have the business itself. And most of us, I think, would kind of try to find a colour that's going to work. Most of us think of it as clinic. That's not going to work either. My pens are dead today. Try green. We think of it as, that's better, maybe. Anyway, we think of it as clinic versus business. That we have these two hats we wear. One is the clinician and one is the business owner. One is the clinician, one is the marketer, one is the clinician, one is the salesperson. And I don't know that this is a very productive way of looking at it, because I think that a really great clinic, in other words, someone who's a great practitioner, who gets amazing results for their patients, but has no interest in, or no ability in, or doesn't invest any time or effort in the business side, is going to always ultimately struggle. I remember my first karate sensei would say to me, "You know what, Alex? You could have the world's strongest, most lethal, most deadly punch, but if you can't connect that punch to your target, then that particular strike has no value whatsoever. So you could equally be the world's greatest acupuncturist, but if you don't have the patients to practice on, then you're never going to get the opportunity to show the world your skill." So having this kind of combination of clinic and business together is what's really important. And one of the things that people worry about, not so much in the sales process, because that's a little bit down the track, but in the marketing process, they worry about what marketing is, and there's often confusion between what's marketing, what's advertising, and what's selling. And in some ways, they're a little bit different. So the way that I want you to think about marketing is like this. Imagine, well, let's think about where the word or the idea of a market comes from. What is a market? So traditionally, I bet that green is invisible. I'm not having much luck with my pens. Think of what a market was traditionally. A market is a place where people go to exchange goods and services for currency of some description, the currency of the day. So it might have been rum or gold or IOUs or money or a check or whatever, or a bank-to-bank transfer. It's a transaction of currency in exchange for goods and services. And a market traditionally was a place where people went for that to happen. So in a sense, the marketplace, you can imagine then that the market was often an accumulation of vendors operating out of the same location. and then we've got supermarkets, and and they're places of commerce, places where people come. And if we think about the market today, we've got a physical marketplace. Supermarket's a good example, or the Saturday morning farmers market, anywhere where you go to buy and sell goods. But we've also got an online market. People who don't actually need to go somewhere physically, but they can call up and make a transaction. They can transact directly online via the internet. But it's a market just the same. So when we think about the market, really what we're talking about are the people. So your market equals people. And when we think about the Health Leaders Academy, or the way that we profile a patient, we're thinking about A-class patients. So not every person is going to be in your market. So for example, if I'm selling menopause service to women in a particular age bracket, there's a whole segment of the market, of the people in the population, who that particular product is not going to be relevant for. Okay, so then the opposite of that is, if I'm selling a menopause product, then I want to try and find the place, the marketplace, where the people who are more likely to need or want my product are hanging out. So we want to take ourselves to the market, in a sense, and determine who they are. So when we talk about who is your A-class client, we're really talking about determining who your market is. Now, you might have a whole range of markets, or a whole range of people or segments within your market. And this idea of a segment is really important, because rather than saying, here is the whole population, because I can definitely try or attempt to market to the population, to the whole market, but in a lot of ways that's futile and a waste of time, because not everybody is going to be interested. Now, a good example of marketing to everybody is a letterbox drop. Okay, now a letterbox drop is not a very effective means of communicating with a market or with an audience, because it's unsegmented. Okay, so I know, for example, because I've done this a lot in the past. I haven't done it for many years, but when we first started out, we did do a lot of letterbox drops, and I might letterbox drop 20, 30, 40, 50,000 flyers across a region. We hit a whole suburb, and out of that 50,000 flyers, well designed, clear message, talking about our product and our service and the benefits, so good advertising material. We put it out into the whole community, and you'd be lucky if you get back 0.001%. Okay, so out of 50,000, if you got 2 or 3 phone calls, that was on average about as good as it ever got. And the reason for that is it's taking it's not segmenting the market. It's really just blurting it out and hoping somebody listens to it. What you're much better off doing is going, okay, my market, and I'll pick on I'll stay with the menopause. My market is women between the age typically of 45 and 55. Yeah, that's my market segment. So in the population, what percentage of the population are women in that age bracket? And it will probably the segment will probably look a little bit like that. So my market are these people, and within that group, I want to segment it further by thinking, well, who within that group is going to be an A-class patient? What kind of person is going to make up an A-class patient? Someone who's going to come, someone who's going to take on my advice, someone who's going to interact with me in a way that's fun for me as well, who's going to be interested in investing in their health, and what kind of way are they going to be able to work together? What is an A-class client for you? So you've got your segment, which is the people within that marketplace, and then you're going to further segment that down by trying to target the people who you would like to see as patients within your practice. Okay, so in some ways, we start with the broader market, the whole picture, the whole population, and we want to try and use our niche or our niches to hone our market down. Now, the obvious question is, why would we want to do that? Well, it's obvious when you think about it with the letterbox drop example. If I'm going to blast everybody in a particular postcode, for example, some postcodes, some demographics are going to be quite different to others. Some suburbs have more young people, more young families, so I'm going to have an even smaller hit rate for my menopause clinic. Whereas some suburbs, some demographics are going to be more skewed towards my market. So I can do some research in that way. So if I can target my audience, target my market, then my advertising is going to be able to cut through a whole lot better. So in terms of setting up our definitions, the market or your market are the people who are going to most benefit from your goods and services. Okay? I hope that makes sense. The market are the people, the audience that are going to benefit most from your goods and services. Now, that doesn't mean they're going to buy from you, but they're more likely to buy than someone who's not ultimately interested in your goods and services. Okay? And a niche like menopause or fertility or period pain or sports injuries or migraines or back pain, these are all good niches to work in. And the reason for that is when you have a niche, you have a tool to help you to further hone and segment your audience. Because if you can do that, then it's much easier to get the message through. I hope that makes sense. So the market, your market, are the people that are going to benefit from your goods and services and have the opportunity to engage you in a meaningful way. Okay, that's your market. When it comes to marketing itself, and I want to draw a distinction between marketing and advertising for a minute. Marketing is the strategy that you're going to use in order to start a conversation with people who might be interested in your goods and services, right? So I think about it in this way. This is you in your clinic with the service that you offer, okay? Here's the audience, here's the market. These are the people that you've determined are going to most benefit from your goods and services. Marketing is the strategy, and this is important. Marketing is the strategy that allows you to build a bridge that works in both directions between you and your audience. Okay? So marketing is the strategy that helps you to create a bridge between the market, the audience, and you, the person who has the goods and services. Okay? And the important thing about that strategy is that, you know, marketing isn't about forcing somebody to do something they don't want to do. And there's lots of kind of sayings around this, and the one that comes to mind is, you know, oh, I could sell ice to the Eskimos. Well, that's kind of a dumb way of thinking about marketing and advertising and sales, because, well, if that Eskimo lives in the snow and they need ice, well, they're going to find someone, you know, to service that need. So what we want to do is we don't want to try and force something on somebody that they don't want. We want to try and engage them in a way that gives them something that is going to add, hopefully, huge benefit to them and their lives. So marketing is just a strategy that's going to allow you to do that. And the thing that I like to think about in terms of marketing and advertising is that the most effective way of building value and building a relationship with somebody between your clinic and the market is to simply start a conversation. Okay, so marketing is the strategy that allows you to bridge the gap between the thing you offer, the clinic, and the audience or the people that are going to most benefit from that. And what the strategy does is allows you to open up a dialogue, a two-way conversation between you and the audience. And that's incredibly important. So whenever we're talking about a marketing message, the most effective way of creating a message is by creating a conversation. And I'll give you an example. We talked about this with one of the groups in Brisbane. We talked about one of the questions was, well, how do I respond to an email? If someone's sent me an email with a lot of detail, history, information, a lot of questions. Now, email is a pretty good way of sending out communication, okay? But it's not a very good way of carrying out a conversation because it's one way, okay? It's one way and you wait for somebody to come back. It's hard to get context. It's hard to make this work in a meaningful sort of a way. So what we want to do is we want to create a conversation. So my suggestion in terms of marketing strategy with email, as an example, is to take that detailed and complex email and send a really simple email back to that person. And the email is about opening up a conversation or a dialogue. And it would say something like this: thank you so much for your email question. I appreciate the time it's taken to write to me, but I think that the answer you're seeking is outside the scope of email. What I'd love to do is jump on the phone and let's answer this in person. Give me your number and a time and I'll give you a call back. So what you do then is you give them the opportunity to respond, and you can open up a conversation. So good marketing is about creating a dialogue, creating a conversation. And remember, the marketing itself is the strategy, is the way of creating the bridge between those two things. Yeah, hope that makes sense. All right, that's marketing. So if marketing is the strategy, what is advertising? Well, advertising is the tool or the tools that you're going to use to actually put that strategy into place. And what we're going to do in a minute when we build the marketing funnels, we're going to talk about the methods of advertising, the ways of communicating with your patients, and we're going to build that out shortly. What I'd like you to do, I'm going to give you about 1 to 2 minutes to do this, is I want you to, just on a piece of paper in front of yourself, I want you to write down all the advertising tools that you can think of, and there might be things that you've already used. There may be things that you haven't used yet. There may be things we've talked about. There may be things that we haven't talked about. What I want you to do is just take a minute or two right now and write that list out. And when you've done it, I want you to post it here as a message. In fact, if you want to just do it that way, post your items as a message, and I'll put the timer on. I'll give you exactly a minute, and then we'll write them up. Okay? So let me set my timer. Timer starts now. Give me all your tools and pop them up here on the chat. All right, let's see, who have we got? Where's our messages? Okay. Got a few things coming up. I'll give you a couple more seconds so we can get a few more. What do we got? Email. Give me a few more, guys. Tools, market, advertising. Okay, so let's go into it. Now that you understand that marketing is a strategy that creates a link or a conversation between you, the clinic, and the market that you've predetermined based on your niche, then the marketing funnel will start to make sense. Okay. All right, let's start to think about a funnel. Why do we have a funnel? I think, marketing, there's two ways to think about marketing. I'll use fishing as an analogy. Now, I'm a hopeless fisherman. I couldn't catch a trout in a trout farm. But it's not a bad analogy. When you're marketing, you want to think about trawling, and I know it's not a great thing to do, but from a marketing perspective, you want to trawl, okay? Because you're going to find that a lot of things will go through the cracks. Even though you've segmented your market, you want to make sure that you've got the broadest possible scope, the broadest ability to talk with as many people within that segment as possible, okay? So we want to make sure that our marketing funnel is broad. So what often happens when we talk about a funnel is that the funnel works like this, okay? And up the top sits your marketing strategy, okay, or the marketing itself, okay? The funnel is made up of your advertising, okay? And the funnel itself is the leads. In other words, who's actually making contact with your clinic, who is starting and engaging in a conversation with you. And then there's probably funnels down even further, actually. Out of those leads, who becomes a first-time patient, and then who becomes a client, and then who refers, okay? So this is kind of the marketing funnel in a sense. You start with the strategy, the thing that, the way that you're going to build, or the ideas that's going to open up the conversation. Then the funnel consists of the advertising that's going to create the conversation. The leads are the people that come directly from the advertising, and then some of those leads you'll convert into patients, and some of those patients you'll convert into clients, and some of those clients will become good referrers, and you'll find that will become narrower and narrower. And this equals A-class patient. Sorry guys, just give me a second. Yes? Sorry guys, I've got a sick child at home who's very unwell, so if I don't disappear, that's what's going on, so I apologise for that. So that's our marketing funnel. Let's have a look at what some other people have come up with in terms of ideas. Sponsorship, posters, phone calls, signage, radio ads, local newspapers, notices at shops, web, Facebook, groups, supermarket, notice boards, email campaigns. Yeah, those are all great examples of what your funnel's going to be. So the things that I kind of use in our practice that I know work quite well Social media is one of those things, and at the weekend coming up in Byron, that's Adam's focus, will be social media and online marketing. And Facebook is a pretty good source of advertising these days, because you can really segment and hone in on your market segment. So, for example, you can run a Facebook ad that is, use the menopause example, is aimed at women between 45 and 55 in a particular region or a particular area, even with a sort of job. There's a whole range of things that they like. You can really target that down and send an advertisement to that demographic. Okay, so Facebook is a really good way of targeting ads. But Google AdWords is similar. It's more expensive, but it's something you could certainly do. Email was one of the suggestions, and it's a good one, because if you've got a database of people on your email list, and these are people who are generally already interested in the thing that you offer, they're warm leads in that sense, and it's a really good way of targeting a campaign. So you can start with a campaign with an idea of a product or a service that you want to run with, and then you can run a series of emails targeted to that particular market or that particular niche, sent to people who already, to some degree, know, like, and trust you. Okay, so email is a really good way of doing it. One of the things that is not used by Chinese medicine practitioners or acupuncturists or natural therapists, or complementary therapists, to use that term, is radio. And I'm surprised at that, because we've been using radio for about the last 4 or 5 years, and it's one of the most effective advertising tools we've discovered in terms of getting our message across. And radio is a kind of cross between, it's harder to segment in radio because you're not sure who's listening at any point of time. But what you can do is you can pick a radio station, for example, that has a particular demographic. Now, the radio station we advertise on in Canberra, for example, their demographic is young, professional females. That's their skew, and that's exactly our market from a fertility and a gynae perspective. Now, if I was talking about a menopause market, then that's not the right station to advertise on. I'd want to put my ads on a different radio station. But people worry about radio, I think, because of the cost or the perceived cost. But I think you find that the return on investment, ROI, for radio is actually significant. We get a lot of leads generated specifically from radio. And probably a week or two ago, I put up a video which is going to be in the next issue of the magazine. Actually, no, it was already published, called the seven steps to a killer radio ad. So if you haven't had a look at that, it's on the Basecamp. Check it out. You should consider radio. It's a good way of reaching a really broad market. Okay, and perhaps not as expensive as you had thought. Other things that we could do, we do some TV. TV is expensive, but it's really targeted. So a TV station will know who's watching what program at what time, how many people, and then they can target that ad to that particular thing. Posters. Your own website, signage on your car, signage out the front. Signage is interesting, actually, because signage is something that people don't necessarily make best use of. Signage out the front could be an A-frame on the street, could be a big sign outside the building, could be signage even within the practice, on the door, in the treatment rooms. Do you have something on your treatment, in the clinic that says invite someone to go on your email list, for example, or if you're going to advertise an event, do you have some signage in the clinic that actually points them to that event? So there's a whole lot of things you can do. Events is a really good one. Now, the format we're using for these coaching calls is basically a webinar, and it's a bit of software called Webinar Jam, and it actually works really, really well. So what you could do is you could run a live event or a pre-recorded event or a physical event. No, so a webinar event would be suitable, for example, for a fertility audience, because what we've discovered over the years is it gets harder and harder to get people to come to a live fertility event, because it's kind of a private thing to do. They're a bit nervous about coming along, and when they do come, they don't ask many questions because they're a little bit shy, and that's fair enough. But if you run it as that event as a webinar, where they can do it from home, there's safety in that anonymity. Perhaps a webinar is a good way of doing that. But if you're running some promotion or some advertising in a sporting niche, for example, or sports injuries or pain management, people are going to be much more likely, I think, to come to a live event. So you might actually approach a sporting club and say, hey, I've got this great talk about improving performance in sport for your particular club. How about we set up a date, you advertise to your members, I'll come and do it for free, and at the end of that event, you make some kind of pitch or some kind of offer that then will encourage people to jump into your funnel. So events are a really powerful way of getting your message out, because it's one of the workbooks that's in the syllabus is called one-to-many, and when we're in the clinical scenario and you're sitting across the desk from a patient, it's one-to-one. Okay, it's one-to-one selling. But when you're talking, if you can talk to an audience en masse, one-to-many, then you've got a much greater reach. Radio does that, So I'm talking once, it's me talking on the radio, and perhaps thousands of people are hearing that and hearing that message over and over again. If you can create an event where you have you speaking to, say, 8, 10, 20 people, and then you've got the opportunity to open up a dialogue or a conversation with those people, and then you've got the opportunity to engage them in a sales process, so that they exchange goods and services for currency, for something that they can see inherent need and inherent value in. Okay, so selling one-to-many, or creating that dialogue or that conversation, is done really well with the use of an event. Okay, and I'd suggest if you haven't run events in the past, then it would be a good thing to consider. And perhaps what we might do is actually, in one of our coaching calls down the line, actually set up an event for you, either a webinar or a physical event. Actually go through that planning process and set it up. Events have been very powerful. And in terms of making conversion, you want to make sure that your message, your conversation within all of this advertising is very, very clear and very, very consistent. So, for example, our message through radio, TV, website, posters, email, Facebook is about, are you considering a natural approach to women's health? Then we may be able to help. For more information, go to our website. Okay. And our message is very consistent in that way. And you can see that it not only asks a question, and this is a really good thing to do with all your advertising material. It not only asks a question, but it also gives them the thing to do, what to do next steps. So if someone's engaging with you in conversation, someone doesn't ask you a question and then you just kind of go, see you later. It's not a good conversation. If someone asks you a question, you want to know what to do next. So my question, the question is, are you interested in a natural approach to women's health issues? Great. Well, this is what to do next. If you are interested, the thing to do next is take these steps. Visit the website, call me on this number, pick up your free whatever. Do you know what I mean? So you've got a question to ask, and then you've got next steps. And that next steps is what's called in marketing a call to action. And really, there's no point in doing any marketing or any advertising at all unless there's a call to action, okay? And the call to action may not be to buy something, it may just be to like this page on Facebook, or put your email in to receive this free brochure or free CD or DVD or whatever it is. Or it may be to actually make a buying decision. You know, the call to action is, look, you know, I've given you all this information. I've answered your questions. Are you ready to make a decision to actually come in as a patient and transact with me goods and services for currency, or goods and services for value, or value for value? Okay, so that's really what the advertising is doing, and these are all just methods of making that work. Okay. Let's see what else we've got. Banner, signage, clinic, posters. Yeah, so, you know, you guys have got some really good ideas. Now, what I want you to do is I want you to build out your marketing funnel, okay? And the marketing funnel must have at least these steps. Marketing, which is your overall strategy. Advertising, which are the individual things that are going to engage your audience in conversation, okay? Remember, you can educate, you can inform, you can engage, but ultimately you want to be able to connect, okay? That conversation, that dialogue is the thing that's going to allow you to transact. And that transaction may just be information to start with, but you've got to get that dialogue flowing. The next part of the funnel is the lead, so the person who actually engages in conversation and comes to you either with a question or the desire to come and see you, to make a booking and to transact. That lead, if they decide to, decide to take the next step, will become a patient at that initial consultation level. Then you've got the opportunity to sell them one-to-one. In other words, you've come in for this reason. This is from my experience and my expertise, this is the path that I can see is going to help us to get to where you need to go. Do you want in? Does it resonate with you? Do you have any questions? And do you want to come with me on this journey together? And that's really where they turn from a patient to a client. And then if you can get that client to not only have a good experience, but then start to talk about that experience with their friends and their peers and their work colleagues and their families, then they become a referrer and what I describe as a hub patient, someone who then does some of that advertising for you. And that's what we call word of mouth. Now, I haven't put word of mouth in the funnel because it's something that you can't control it in the same way as you can control whether a radio ad gets to air or not. And that's why refer comes down the line. But really, you've got to make each of those steps in your advertising or your marketing strategy or your marketing funnel. So draw the funnel, think about those elements, and fill the funnel with all of the things that you've done already. And what I want you to do is prioritize the things that you think work and don't work. And then I want you to think about what else can I try that might put more leads through my funnel, or more people into conversation with me about the things that I offer. And it's interesting, I was reading some marketing information recently, and this particular marketer said, look, the business that wins, the clinic that wins, has two elements. One, is able to open up a conversation with as many interested people as possible, and two, the way to create those conversations is to invest in your advertising and your marketing funnel. So the more, if one radio ad works, then maybe 10 radio ads delivers me 10 times the leads. If running my TV ad 5 times a week delivers me a certain number of leads, I should be able to upscale that. What are you prepared to spend or invest, whether it's financially or in time, to create the numbers of leads that you need? And that's a really good way of thinking about it. What are you prepared to do? So build out your marketing funnel, put as many things in there as you can, and then, as always, the most important thing you can do is to implement. Actually go and do it. Because I can draw a lovely picture of a funnel here, and this is my funnel at the moment, which is working pretty well. But unless you actually go and take action on that and implement it, then it's going to remain a picture on my whiteboard. And I'd much rather it become something that you action and start to work in your practice. You'll all have a marketing funnel already. Some of you will be will have created it consciously, and some of you will have created itself unconsciously. Much better to have control over the funnel and put it into action. The beauty of setting it up in this way is that once these elements are in place, then the funnel itself works on, or should work to a high degree, on autopilot. So I recorded the radio ad, I filmed the TV ad, they're running, I don't need to think about them again. Every day, every week, every month, every year, they will generate a conversation, a lead, and therefore a patient. Okay, so if you can get your marketing funnel to work like that on autopilot, then it's very easy to upscale and downscale depending on how many leads you want to be coming in through the practice. I hope that makes sense. All right, that's what I wanted to cover today. We've got a few minutes left to answer some questions. So fire away some questions and let's see if we can get through them as quickly as we can. So let me just jump down here and have a look. While you're putting your questions in, someone suggests networking with doctors, and I think that's a really great idea. If you can build a network of people who provide a similar or a related service, then that's going to go a long way in terms of developing that referral network. Okay. In my experience, a referral network will only work as well as you, depending on the time you invest in it. So if you're not making constant contact with the people in your network, then when they there'll be a point where they stop thinking about you, and when you go out of their mind, then they'll stop referring. So you've got to find a way of keeping it at the front of their mind in terms of making referrals as well. Okay. Questions? Let me take a picture of this so you can have it. For anyone interested, this software is called Webinar Jam, and it's basically an overlay for Google Hangouts. It's a really good tool for webinars, and it's actually a really good tool for interviews as well. We use it in the magazine for recording interviews if someone's overseas, for example. So you can have multiple presenters, you can have video, you can have audio, and you can also just do a screen recording as well. So it's a pretty good tool, a good way of creating advertising materials, a good way of connecting with an audience, particularly if you're doing an online event. A webinar is a great way to do it. Okay. And the other thing it does, and you would have noticed this process, is that it requires you to register, so you get the links to the presentation itself, so you can start to collect emails that way and build that email list. Okay, so email is a really useful tool. You want to make sure you get as many people on your email list as possible so that you can have a conversation with them. All right, let's see, what questions have we got? I must have done a really good job because there's no questions coming up. All right, guys, well, that's what we covered today. Marketing, just a quick recap. What is a market? Who is your market and how do you determine it? What is marketing? Marketing is the strategy that creates a bridge or opens a dialogue or conversation between you, the clinic owner, and the goods and services you offer, and the audience, the people who are going to benefit from that goods or service that you do, and allows a transaction. The funnel itself is full of advertising, and the advertising is the how, the way that you're going to connect with that audience. Okay, and once people are in your funnel, then you're going to start to filter down to people who are really ready to take the plunge and invest in you so you can invest your time in them. And that's really the nature of the marketing funnel. What you put in there is up to you, but there's some good examples. If you're not sure, post it on Basecamp. We'll have a look at it. There's a question here from Diane. Hi Diane, hope you're going well. Nice to see you up in Brisbane last week. Her question is, did you write your own radio ad, or did you obtain professional advice? I actually wrote it myself, and there are seven key steps to writing a radio ad that works, and they're in that video on Basecamp. So I suggest you have a look at that. But make sure you always start with the aim in mind. What do I want? What do I want this radio ad to achieve? Who's my market? Who am I talking to? And what question is on their minds that I can answer for them? And our radio ad basically leads off with, are you interested or thinking about a natural solution to, women's health conditions like fertility, pregnancy, period pain? Then this is something we can help with. Okay, so that's the basis of a radio ad. Have a look at the video, the 7 steps to a killer radio ad, and give that a go. Now, if you're in a regional area, like I know Di is, then you might find that the advertising rates on radio are actually quite reasonable, and you can reach a further spread. So if you're in a regional area, you might find that radio signal will actually go a lot further and drag people from a broader region. Okay, and that's another reason radio is great. We get people from sometimes hundreds of kilometres away who get the radio signal and decide to come in. Okay. Terrific. Well, thank you so much for coming along. It's a great pleasure. The recording will be available shortly as well. If you feel like there's someone who would benefit from this information who's not in our group, I'm happy for you to send that link on and happy to get in touch with them also. We have I'm in Melbourne this Friday in a couple of days' time for the implementation day in Melbourne. I'm really looking forward to that. Love coming to Melbourne. Looking forward to seeing all the Melbourne team, and then the week after I'll be in Sydney for the same event, and that'll cap off our first 3 implementation days. And then, of course, the Byron Bay weekend with Adam and all the gang is coming up very shortly in October. That's going to be terrific. If you can make it, you definitely should. It's going to be all about Facebook and social media and online marketing. Very, very potent, very powerful stuff. So make sure you're there. Not to mention Byron's a pretty cool place to hang out. Anyway, so I'm going to leave it there for now. Good luck with everything, and I look forward to speaking with you soon. Bye for now.